Okay, you're welcome back. In this week, we are going to see pharmacodynamics and pharmacokinetics. Remember, I've already given what we're supposed to know regarding uh, these chemicals when they enter the body. What happens to the chemicals themselves, and what does the chemical do also to the body? All you need to know so that you should be able to easily correlate between what you have seen or what extent are you expecting somebody to behave in a certain way? Because if you have a suspect and they discover that the suspect is not showing any sign of influence or under the influence of any drug or any chemical, it doesn't look like that. So what important thing you will look at also, how long of this crime occur? Yes. Since when does these things happen? Because that also matters, because the body will take care of those things after some certain period of time. We'll talk about what we call half-life. So if you take any particular drug, the drug will be in the system active for some period of time. By the time the body clears these things, because one thing we need to know is apart from anything food or that body needs, once you take any foreign substance in your body, the body actually wanted to remove it out. The body will say, okay, there is an infant pattern. Is that something we are going to utilize to build the body or to help us in any metabolic function? If the body discovers that, oh, this test is not legal, this thing is something coming in, we don't know why it is coming in. So even the drug, the body doesn't know it. So the body will say, oh, we need to take this thing out. Then the body will start the process of pushing this thing out. So it means converting it to something. We enter some reactions where it will come out of the body. So that aspect that the body doing all it can do to take that thing out of the body is what we call the pharmacodynamics. While the pharmacodynamics is while the body is trying to push you out, you are also trying to do what you are there to do. So if you are a drug, if you're really a paracetamol, you will try to relieve pain while the body is trying to push you out. You are a toxin, you try to cause toxicity while the body is trying to push you out. Pardon. So for pharmacokinetics, for pharmacodynamics, we know that the chemicals, what do chemicals do to the body? And for poison, we know they kills. They bind to some receptors and they causes some signals that lead to the bleed in the goods. For drugs, we look at some classes of drugs that are mostly been taken or abused and then leading to causing a lot of criminal offenses. We have CNS stimulants, which are central nervous system stimulants. We have central nervous system depressant. We have narcotics. We have hallucinogens. We have inhalants. So most of them actually There are things that are related to central nervous system coordination, to either distort coordination or restore coordination. But if they are misused, then they can lead to losing coordination and then making somebody to behave in a certain way. Like in central nervous system stimulants, like cocaine, amphetamine, caffeine, nicotine, etc. Nicotine is commonly found in tea. Tea is something with it. Caffeine also is something. It actually stimulates your central nervous system. It makes you feel awake. It will increase the brain activity, increase your heartbeat, increase your rate at which you are breathing, making you very alert, making you very conscious of your environment. Although you will have some restlessness, feeling of euphoria, hyperactivity. Also, people are misusing this, and it makes them to behave in certain way, this overactivity. We have also central nervous system depressant. Central nervous system depressant belongs to, some of them belongs to barbiturates, benzodiazepines, have alcohol. So what they do is they depress the activity of central nervous system. Just like stimulant, where they make the central nervous system activity to be high and alert. But these ones, they depress the activity of central nervous system and making the central nervous system to be very slow. So, central nervous system is all about coordination. So you will have a very slow coordination. You will have even difficulty in thinking and processing things, very difficult to understanding certain things, feeling sleepy, less anxiety, and all these reactions like very, very slow and weak, doing things as if they don't exist. Sometimes you'll be seeing yourself to be alone in a particular environment. Don't see anybody. Why? Simply because your brain doesn't capture and process things within a period of time, or you seeing people being very fast, but because your brain cannot, and then you just see everything just slow because your brain is not coordinating well. So some of those things are actually things we take in to treat certain normal issues like flu, cold flu, like muscle relaxants, sleeping aids, all this antihistamine to avoid allergy, all this we take for, all these drugs we take for catarrh. So that's, some of them contain some of those chemicals that we've taken more than what you need to take, they can process all these things. And this can lead to a lot of criminal offenses. We have narcotics. Narcotics are also classified under depressants now. Relief order will slow the activity of central nervous system. They actually potent painkillers. They are pain relievers, just like paracetamol, but these ones are very strong ones, very strong pain relievers. They bind to what we call opiate receptors in the central nervous system, and then they induce sleeping, pain relief. Yeah. Depress central nervous system, reduce their heart rate at which the hearts pump blood into the system. So your system will be getting all this repairing, very repairing, very, very slow at a very slow rate. Even the breathing will be very slow. So you just be very slow. Like, so some of those people will be taking things and they will be in one place as if nothing is happening. Nothing is happening. They are just, they feel the world is just quiet and nobody is there for them. So all this kind of feeling, sometimes it makes people to feel like, oh, they can go on. They can even see some things around them and like, oh, nobody is here, nobody is seeing them, even though people are still around. It's under the influence of drugs, codeine, tramadol, fentanyl, where things are being. Others like inhalants are chemicals product that they can inhale to produce some psychoactive effects. This that will change your mental state, your thinking, your thinking process, bring hallucinations, delusion, dizziness, making things appear as if they are not there, but you see them around, imagining your some images, they are there, but they are not there. Or things is not there, but you think it's there. Outside your imagination, your thinking, your mental states. And things like glue, gasoline, paint thinner, spray paints, toilet fumes, because of course some people go in-house in toilet fumes. Yes, it takes them out of here. It's like hallucinogens. Hallucinogens, they alter the perceptions of reality, visual, auditory, emotions. Marijuana is very common. Synthetic cannabinoids, etc. So they bind to cannabinoid receptors in the brain and actually change one's perception, your memory, your mood. You see, most of those people, they're very moody. Just these chemicals are actually altering their habits. So they can be very moody, kick in these things and they change your mood. Small thing, they will become very ferocious, easily attack you and just these chemicals being taken. It's changing their thinking. Now, this is basically some of the most common chemicals that actually change these people perceptions, the way they see things, easily make them to commit a lot of criminal offenses. So you need to know these chemicals. These ones I just pick a broader classes of them, like 5 classes of them, broader, but there are much more broader classes where you will know them with examples. So that as a forensic toxicology, you should be able to know these things, and you should be able to know that this is what they do, and this is what they cause to the biological system, and this is what made someone to easily go out of the scenes and be able to commit this kind of atrocities. And so once you see this kind of physiological responses in an individual, you should know that, oh, this person must have taken something that's because it's inflammatory, it will stimulate this inflammatory system. Something there about, because like I said, almost all these things are actually linked to central nervous system, either making the central nervous system to be very active or making the central nervous system to be less active, that the stimulants form or depressants form. Even the marijuana we mentioned, the hallucinogens, the opiate receptors will actually bind to some certain receptors in central nervous systems. So where drugs that are can actually pass through the blood-brain barrier causes of this responses to or stimulate to this response will trigger this response to central nervous system leading to an individual behaving in some certain way, changing the mood, making them to go and act in some certain ways. So we should know that this is what these chemicals do. This is how somebody responds under the influence of these chemicals. But the question is, for how long these chemicals will remain in somebody's system? You should also be able to know how does the body take care of those things, so that you should know also if you've taken some analysis, you've observed this, or somebody told you that, okay, when they caught him, this is how we give him, this is how we give him. And then you want to carry out your analysis to take a sample, know, okay, if I assume that you've taken this, and then you check, you're expecting this to be excreted in the urine, you take your urine, and you check that that thing is not there. You should be able to know. You should be able to know. Is that this will still remain in the system, or the system might have taken care of? If the system might supposed to have taken care of, is that thing something that the body can actually deposit in part of the body somewhere that I can still access and then check? We should be able to know. So what does the body do to the drug is what we call the pharmacokinetics. So in pharmacokinetics, we have this three vistas or four process phenomena that can happen. First of all, we have absorption. Those chemicals will have to be absorbed by the body. How the chemicals get absorbed by the body will determine how long the chemicals will remain in the system for what is the point of entry of those chemicals. So if you are looking for them, you should also be able to know the point at which maybe somebody will tell you, we were together with him just a few minutes ago and you said I went and committed this kind of things. Yeah, it's possible it's under the influence of those chemicals. Maybe the chemicals was taken in maybe by injection or it's something like you should be able to know how long will it take for that individual to be under the influence of those chemicals? How long these chemicals can still maintain in the body? So absorption, distribution, how long will it take to be distributed to different parts of the body? So by knowing the chemicals, knowing the nature of the chemical, you should be able to know that all these chemicals is something that can be separated. All these chemicals is something that takes some time to. So you see a certain situation that when the question is about a certain chemicals, and you feel like, this chemical is actually a chemical that takes a longer period of time before it starts acting, or take a longer period of time before this happens, or take a longer period of time in the biological system before it's get to excreted completely. And you check in and find out that the chemical is there is no traces of the chemical, no metabolite of that chemical in the system, and it's assumed that it says, people that touch him, you observe some certain behaviors as rules. Some physiological response attributed to that chemical tells that not really that chemicals taken by them. So now starting with absorption. In absorption, a chemical can be absorbed in many ways depending on the route of administration. How is it administered? It can be ingested orally through that's for intestinal tract, where it passes through the stomach, intestine, and then goes to the liver. It has to be absorbed. So all the absorptions take some time for absorption to occur in the intestine through the enterocytes. Then from there it will enter into the liver. Before from the liver, then into the blood circulation. From the blood circulation, it will then enter into the different part of the body where they perform its own function. So it can also be inhaled through the lungs. So you see some chemicals can be taken, especially smoking, through the lungs. So chemical can easily be absorbed on the lining of the lungs. From the lungs, into the blood vessels, they're within line, easily allow the movement of substances in and out. So that is why oxygen can easily include the inhalation for these alveolar cells. Then the carbon dioxide also itself out of the body. Can also be through injection like intravenous, where chemicals can also be injected directly into the blood vessels. It can be intramuscular between the muscles gradually. So that one will gradually enters, gradually. So it has possibility of taking a longer period of time. So the absorption takes a longer period of time. Sorry, the oral absorption takes or take a longer period of time than the inhalation and the injection. Then you have intranasal, mostly in the case of cocaine, heroin, and so on. Then you have sublingual oral mucosa under the tongue. You can have those ones also have a very rapid absorption. You can have derma put on the skin. So all those ones were, and it determined how long will it take to get into the system. And then that you can also be able to relate with how long maybe somebody left a particular place where they're taking these things and the time the crime was carried out. And if you were able to know also from that time, the time it was caught, or the time it was reported, all that is still in the system. So distribution now has to do with the movement of that chemical from the blood, the interstitial fluid, and then inside the cell, what it carries out function. Because some chemicals will bind to some proteins in the body, thereby limiting them their movement into interstitial fluid and then finally cell. While some binding make them more facilitate their then you have metabolisms. What happened to those chemicals? Because some chemicals, when they enter the body, like I said, also there are a lot of enzymes, proteins that are involved in metabolizing, converting them, because the body want to get rid of them. They want to take them out of the body. Now, how to take them out of the body is that some of them can easily go out of the body, while some cannot go out of the body just like that immediately come out. But what happened this process of combustion or easily excretion actually is to make the molecule more soluble so that it can easily be excreted in feces or in food. So if the drug that is taken is already very, very polar, even though we know polar molecules hardly find themselves absorbed through the intestine. That is why sometimes even the ingestion comes in so that to avoid loss of limit during absorption in the small intestine. The small intestine does not allow much of highly polar substances to get in. You take in a drug that is highly polar, there is high chances that a significant amount of it will be absorbed into the body. Therefore, that is why other method of administration comes to be. So once those substances, so it's very difficult for polar substances to get into the body unless you change the route, and then even changing the routes is also making it. So once it gets into the body, then as treating, if it is polar, it's much easier for it to use. But if it is non-polar, it has to be converted by a set of enzymes on the metabolic process. Those enzymes will now two-step process, phase one and phase two. Phase one will add a functional group, and phase two will add something that will conjugate it, making it highly polar so that it can easily be excluded. So if you have a drug, taking a drug, somebody can still take, you can still take that particular drug in biological system using any of those analytical techniques which we will discuss with the second person, like HPCL, the LCMS, CCMS, etc. Or not all that chemical. For example, you've taken chemical X. You don't expect after a period of time to still found chemical X in the body. If the body metabolizes chemical X to chemical X3 or to chemical Y, it can convert chemical X to chemical Y. And so that is the metabolite of this chemical X. So if you detect chemical Y, it simply also saying that all the body is the one that converts chemical X to chemical Y. So you should be able to know. Elimination. So in elimination, what happens is in elimination, the body will now excrete this. And this excretion can take place in many ways. Like I said, it can be through urine, by the kidney, or it can be in pieces by the liver, where it passes through the, what do you call it, where it passes through bile duct. I'm trying to remember, okay,